Hello friends, I am Pranita Sheshni, the student of Brisang Training Center. Today I am here with you to discuss the non-technical topic. In that today we are going to discuss the pharmacovigilance. In that the sub point that is the minimum criteria for reporting the adverse drug reaction. What is the adverse drug reaction? The adverse drug reaction are unwanted or harmful effects resulting from the use of a medication. Reporting ADRs is crucial for ensuring the patient safety and improving the drug regulation. Uh, uh, Following is the criteria for reporting the ADR. In that, the first is the patient information. In that, the first point is the age and the gender, essential for understanding the demographic context of the reaction. Age of the person or patient or gender of the patient is very important. Then next is the medical history, any pre-existing conditions that may contribute to the reaction. The next point is the drug information, the name of the drug, dosage and route and duration of the treatment. Name of the drug, it is generic and or the brand name. Dosage and the route, it is specifies about the how the drug was administered. Then, duration of the treatment, how long the patient has been on the medication. Then, next is the adverse reaction details. In that, first is the description of the reaction, clear and concise details about the ADR, including the onset, duration, and the severity. The next is the time of the onset. In that, when the ADR occurred in relation to drug administration. The next point that is the outcome, the current status of the patient, whether resolved, ongoing, or resulted in the death. The next is the causality assessment. What is meant by causality assessment? It is a relationship between the drug and the adverse event. Assessment of the relationship. In that, an evaluation of whether the drug is likely responsible for the ADR. Tools like the Narjo scale can help in this assessment. The next point that is the additional factors. In that, the first is the concomitant medications. What is meant by concomitant medications? Any other medications the patient is taking that could affect the reaction. The next point that is the laboratory or the diagnostic findings. In that, the first this includes the relevant test or the results that support the ADR. The next main important point that is the reporter information. In that, it includes the name and contact information. It is essential for follow up if more information is needed. The next point that is the laboratory and the diagnostic findings. In that, the test includes two diagnosis of the diseases and the concomitant medications, means the medications which are taken before but they are does not affecting the current medications. The next is the professional role. It indicates the qualification of the reporter. For example, the physician, pharmacist means professional role. It includes who report the adverse drug reaction to the regulatory authority, which is taken by the patients or from the patient history. Then at the end, the conclusion of the minimum criteria of reporting ADR, that is the reporting ADR is a vital for pharmacovigilance and improving the medication safety. Then, ensuring that the reports meet the minimum criteria enhances the quality of data collected, ultimately beneficially and the public health. Today, we discuss the minimum criteria for the reporting the ADR. In that, first we see that the patient information, then the drug information, then next is the adverse reaction details and causality assessment, and next is the additional factors, report information, and the last one is the conclusion of the reporting ADR criteria. I think it is clear to everyone what we today discuss. Thank you friends for listening me today. Thank you again.